Welcome to Affiliated Physicians Nurse Training for Flu Vaccination Programs. Whether this is your first season with us or you are returning again, we're excited that you've decided to join us in providing the benefit of a flu shot to our clients' employees. Be prepared to take notes in the event that questions or comments arise that you would like to address with us. We'll provide contact information at the end of the presentation. This online training will take approximately 20 minutes to complete and is intended to reinforce the training you've already received over the phone. We will provide you with all the information that you need to know in order to successfully manage and administer a flu vaccination program. At the end of the training, there will be a quiz. Let's get started. First, a little about affiliated physicians. In addition to performing flu shot clinics near our headquarters in New York City, we provide flu shots around the country. We've been in business since 1982 and have many clients who employ us year after year for their flu clinics. It's your professionalism and great customer service that keep them coming back.
I have to re-upload the whole thing because
now we'll cover what you can expect once you are assigned clinics to work. Our staff will call you to ensure you've completed this training and will arrange a mutually agreeable time for you to receive your supplies. If you work for an agency that does not allow us to ship directly to you, you will need to pick up your supplies at the agency. We will also send you an email confirming the details of the program. Included in your confirmation email will be an event sheet. This basically outlines all the details of the event, providing the who, what, when, where, and hows of the flu shot clinic. It will allow you to do some advanced planning in terms of determining travel time to the location, and will outline whether there are any special instructions for this location. The sheet also serves as your timesheet. You'll get another copy of the event sheet with your supplies, so if you don't have a printer, don't worry. We rely on you to review the event sheet well in advance of the event so that you can know where you're going and plan your route, allow adequate travel time, and arrive on time or early to the site. You'll note that your designated arrival time is event-specific and listed on your event sheet. Please make sure you check your event sheet for the arrival time. You are expected to arrive in advance of the program start time, typically between 30 and 45 minutes before the clinic starts. So the first step to a successful program is meeting this expectation. This allows you to set up your station, get familiar with your surroundings, troubleshoot any issues, and start delivering shots at the program start time. A side note before you leave home, please use discretion when choosing what to wear to your flu shot clinic. You should be dressed as though you're headed for a job interview. Neat and conservative clothing, no scrubs, sneakers, or Crocs. If you have tattoos, cover them, and please wear minimal jewelry. As a medical professional, you should also keep in mind that many people have sensitivities to soaps and perfumes, so be mindful before applying any heavily scented personal products. We aim to provide the best patient experience, and we rely on you to help us deliver that. We count on you to maintain a professional and courteous demeanor throughout your program, as this is key to client satisfaction. And happy clients are repeat clients. Always be kind, courteous, and respectful. Talk in a low, calm voice, being mindful of your responsibility to maintain patient privacy. If an issue arises, please do not attempt to remedy the issue yourself. Contact affiliated physicians, and we will intervene on your behalf. The majority of our clients are very satisfied with their flu vaccination programs. However, there are some guidelines you should adhere to that will prevent possible complaints. First and foremost, be on time to your program. While being friendly and courteous is important, being chatty is a fast way to get behind schedule. Make sure your station is set up with the items you need in close reach. Familiarize yourself with the paperwork and stay brushed up on shot administration techniques so you can move through participants quickly. Know the vaccine composition so that you don't have time to look it up if asked. While the use of gloves is really for your benefit, wearing and changing gloves for each patient gives the perception of cleanliness and care that our clients expect. It is a must that you wear gloves and change them in between patients. Being on your phone at your station is only okay in an emergency. If you do have an emergency, alert the company contact and step away to use your phone. Finally, be very careful to properly dispose of all sharps and other medical waste by sealing it in your sharps container. Carelessly discarded medical waste leaves a very bad impression about you as a medical professional and about affiliated physicians as a quality provider. Preparedness is a very important factor in executing a successful flu vaccination program. With that in mind, let's look at affiliated physicians' policies and procedures for on-site flu vaccinations. Your supplies will come in a crate via FedEx. Depending on your situation, we will either ship directly to your home or to your agency. The unpacking portion of this presentation is based on supplies being sent directly to your home. It's important that you open the crate immediately upon arrival, both so you can get the vaccine in the fridge and to ensure you have everything you need. Please also note that each crate is packed specifically for each clinic, so if you receive multiple crates, make sure not to mix up the supplies and paperwork. This form will be included in your paperwork. It's a quick and handy reference that should allow you to take inventory of your supplies when they arrive. Included in your crate will be everything you need to conduct a standalone flu clinic. As soon as your crate arrives, check the vaccine to make sure it's cool to the touch. Unpack the vaccine into your fridge and put the ice packs in the freezer to refreeze. If your vaccine is warm upon arrival, call us. We'll send fresh vaccine if need be. In addition to your vaccine, in the crate you'll find clinical supplies, everything you need for administering the vaccine. You'll also find administrative supplies, that is, items that are not essential but which we'd like you to make use of. It's especially important that you wear the name badge we've provided. The stickers will be located in your nurse paperwork folder. Stickers make great advertising for the program while you're conducting the clinic, and lollipops are both a treat for participants and a quick dose of sugar if someone feels faint. You'll also have an emergency kit. We'll discuss emergency procedures later. Again, we'll stress here that in most instances, you will have your supply crate well in advance of the program. It's critical that you check the contents as soon as you receive it, so that if there's a question or a problem, we have time to address it. On your paperwork, we'll provide a contact number for questions, issues, and emergencies. If you run into trouble and may be late, please contact affiliated physicians immediately so that we may contact the client. Never contact the client directly prior to the program. Only upon arrival at the site should you ask for the contact person so he or she can escort you to the program location. Despite the best planning, we know sometimes things go wrong. It's critical that you communicate with us so that we can, in turn, communicate with the client. Even if you're only going to be 5 minutes late, we need to hear from you. Occasionally, we don't answer the nurse hotline because we're on the phone with other nurses. If you don't get a live person, leave a message and we will call you back. Please program our nurse hotline number into your phone for easy access. Once you're in the program room, you can set up your station. Take note of how the room looks so that you can leave it the way you found it at the end of the program. Set out a tablecloth and chucks. Put your supplies and paperwork within easy reach, and have a space set aside for collecting consent forms. Open your glove box and some bandages, and pre-fill no more than 10 syringes. Being prepared well in advance of the program start time will help you stay on schedule. If you have plenty of time before the program begins, go ahead and sign and date some consent forms and fill in vaccine lot numbers. All of the paperwork you need for participants will be in your participant forms packet. Some, but not all, programs require the use of a privacy screen. If provided, you must set it up. Some simple assembly is required, and instructions will be included with your kit. If you're unfamiliar with privacy screen setup, review the instructions prior to your program. Set it up for maximum privacy based on the layout of the room. A note on personal items at your flu station. Keeping a drink on hand for yourself is acceptable, but food at your station is not. Also, you may keep your phone handy in the event of an emergency, but otherwise do not use it, even during downtime. You should look alert and ready to accept patients at all times during the clinic. Sending you the supplies ahead of time allows you to familiarize yourself with the paperwork prior to the event. In your participant forms packet, you will find all the paperwork specific to your program, a sign-in sheet, consent forms, and vaccine information statements. The label acts as a packing list and will indicate how many of each form is enclosed, as well as the type of form that it is. As participants arrive, have them sign in by printing their names on the numbered line. The number on the sign-in sheet should then be transferred to the patient's consent form. Do not add or change numbers on this sheet. If there are multiple nurses working a single program, each nurse will have a sign-in sheet with a distinct set of numbers. If you're working a program with online registration, the employee will select a time slot online prior to the program. We will give you a copy of the registration report so that you can adhere to the time slots. If you have walk-ins, have them return at the end of the program to ensure you have enough vaccine for those who signed up ahead of time and so that you can stay on time with pre-scheduled appointments. Please don't use the registration report in place of the sign-in sheet provided. Once the patient has signed in, you'll take a look at the consent form. The sign-in sheet number is the line number from the sign-in sheet. You should write that in on the consent. The participant should complete all the rest of the personal information which is indicated. You should ensure that the information is filled out completely and legibly. The bottom portion of the participant section of the consent form is the HIPAA privacy notice. Please make sure that the participant signs and dates this part of the form. You will have a copy of our HIPAA policy in your nurse folder. If a participant wants a copy, you can make a copy on site, allow the participant to take a photo of it with their phone, or have them call us to receive a copy via email. This middle section of the form is critical insofar as the answers to these questions guide you in whether there is any reason not to administer a flu shot. Take a moment to look at the questions. If the answer to any question in the left column is yes, then you should not administer a flu shot. Yes answers to questions 4, 5, and 6 leave you with some latitude. Question 4. If the client is feeling ill but is fever-free, it's okay to vaccinate. Question 5. If the patient is allergic to thimerosal and you have T-free vaccine with your supplies, use that to vaccinate. Otherwise, refer the patient to their primary care physician. Question 6. The states of New York, Illinois, Washington, Missouri, Delaware, and California require that pregnant women be vaccinated with thimerosal-free vaccine. Thus, we include doses of T-free vaccine for programs in those states. If the woman is or may be pregnant, administer the T-free vaccine only. In states where this is not the law, you may administer the vaccine you have on hand. The final part of the consent form is for you to complete. To speed up your process, you can save this until the end, but it must be completed in full before you return the forms to us. If vaccine labels are not on the barrel of the vaccine vial, we will provide labels for you. If you run out of labels, you can print the information yourself. All of the T-free syringes have labels on the barrels. Affix the label in the T-free box provided. Remember to check off the injection site, indicating the arm where the vaccine was administered, and mark the VIS provided box. Write your name clearly and sign and date each consent form. Please make certain that both you and the patient write on these forms clearly and legibly. We will have provided you with a vaccine information statement in your folder, which is in a sleeve. In addition, you will find one in the participant forms packet. Our experience is that very few people elect to take a copy. It is your legal responsibility to offer each participant a copy, but you don't need to force anyone to take it. If you're down to your last copy, you can always make more copies on site, have the participant take a photo with their phone, or direct them to the CDC's website on the form. Now, let's look at the proper way to deliver shots. Prior to drawing any syringes, shake the flu vaccine vial well. Each vial should yield at least 10 doses. Please don't waste serum by squirting it into the air. It's important to pre-fill some syringes so that you're efficiently giving shots right from the beginning of the clinic. But don't pre-fill more than 10 syringes prior to the start of the program, and never pre-fill syringes prior to your arrival at the event. We schedule programs anticipating that each nurse will administer 24 shots per hour. If you are very busy giving flu shots, leave some of the paperwork for downtime. With each new participant, remember to change your gloves. This is for your protection, but it conveys a level of care and cleanliness that is reassuring to the client as well. Maintaining an aseptic environment is very important. Wipe the injection area with alcohol. With your non-dominant hand, bunch up the muscle. With your dominant hand, insert the needle at a 90-degree angle to the skin with a quick thrust. Push down on the plunger and inject the entire contents of the syringe. There is no need to aspirate. Remove the needle and simultaneously apply pressure to the injection site with gauze. You can ask the patient to hold the gauze in place while you dispose of the syringe in the sharps container and get a bandage prepared. Cover the injection site with a Band-Aid. Your safety is a top concern to affiliated physicians. Therefore, be mindful and use extreme care when handling sharps. When you set up your station, make sure the lid is snapped securely onto the container on all four corners. Keep the container within easy reach, do not overfill it, and only use one hand to dispose of the needles. Never recap needles, as this can lead to needle sticks. Most importantly, remember to always stay alert. In the rare case that you do get stuck with a needle, please try to remain calm. It's okay to notify the site contact if you must excuse yourself to clean up and/or to call us. It's okay to stop the program to talk to the patient. You should bring him or her into a private area to discuss whether they have any communicable diseases that you should know about. You may remove yourself from the program to wash the stick site for 5 minutes. Save the needle if possible for testing. Finally, please contact affiliated physicians to speak with one of our physicians about the incident. On a rare occasion, a patient may change his or her mind about receiving the vaccine after completing a consent form and signing in. In this situation, simply put a line through the person's name on the sign-in sheet and draw an X through the consent form. If you need to leave your station for any reason, always notify the company contact. Unless it's a true emergency, wait until there is a lull in patients. It's important that you're familiar with this year's vaccine, as patients will ask about it. Please note that we offer companies a choice of vaccines. They can choose either trivalent or quadrivalent, and they can choose multi-dose vials which contain thimerosal, or single-dose syringes which are thimerosal-free. Vaccine composition is a common question asked by clients, so please make sure you're familiar with the strains. You can find this year's specific strains on both the CDC website and on the RN Key Points document, which is in the nurse folder you received with your supplies. Trivalent vaccine will contain 2 A strains and a B strain, while quadrivalent vaccine will contain 2 A's and 2 B's. You may wish to read about the flu and flu vaccine on your own ahead of time so that you feel well educated on this topic. Section 5. Emergency Procedures. Now that you understand what you have to do to administer your program, let's spend a minute on affiliated physicians' emergency protocol. Your supplies include equipment to be used in case of reaction to the vaccine. Included in the kit are blood pressure cuff, stethoscope, epinephrine, filter straws, Benadryl, syringes, needles, emergency protocol document, incident form, and the physician's standing order. If you're not familiar with the use of filter straws, they are for use with the ampules of epinephrine and discussed in the emergency protocol document. Please review it. First, adverse reactions are extremely rare. Nevertheless, we should be prepared. The most common reaction is soreness at the injection site. You can advise that any affected patients use ice and possibly a pain reliever of their choosing, such as Advil or Tylenol, to relieve soreness. In very rare events, patients may experience an anaphylactic reaction. Anaphylactic shock is identified by the swelling of the patient's face, tongue, and airway. This can lead to respiratory distress. In the event of anaphylactic shock, call 911 right away. Familiarize yourself with the symptoms of anaphylactic shock and recommend treatment. Anaphylactic shock should be treated as follows. The emergency kit contains 2 1 milliliter vials of 1 milligram per milliliter of epinephrine. The treatment dose is 0.3 milliliters administered intramuscularly every 3 minutes until EMS arrives. Please also document the patient's vital signs as well as all meds administered. For less severe reactions, such as itching or rash, give 0.5 milliliters Benadryl intramuscularly into the deltoid, increasing to 1 milliliter depending on the severity of the symptoms. A vasovagal reaction may be identified by fainting, lightheadedness, and/or dizziness. In the event of a vasovagal reaction, place the client supine on the floor with his or her legs elevated. Monitor vital signs periodically. In either event, call affiliated physicians before leaving the client to report the incident and complete an incident report. Once you have finished giving shots, it's time to prepare to leave. It's important that you leave your individual workspace as neat and clean as you found it at the beginning of the day. All sharps should be in the sharps container. Trash bags should be tied off and placed neatly in the corner of the room or by the door. Once the program has ended and you've cleaned up the space, you should let the contact on site know that you're leaving and have him or her sign your timesheet and make a copy of the program sign-in sheet for the company's records if they wish. Use the checklist on the post-program instructions provided to ensure that paperwork has been completed. Your completed paperwork should be packed back into the participants' forms packet and should include the sign-in sheet, your event sheet with your time filled in and signed by you and the company contact, and all consent forms, which should be numbered to match the sign-in sheet number, filled in and signed by the patient, and with vaccine lot number, date, and your name and signature as well. You may need to wait a day to return supplies to us so that you can ensure your ice packs are frozen. We rely on you to send back the serum in such a way that it will still be viable when it reaches us. Included in your paperwork will be a FedEx return label. Make sure you remove the original label from the crate and replace it with the label addressed back to affiliated physicians. Use the zip ties provided to hold the crate shut just as it came to you. Drop your crate at a FedEx facility for delivery back to us. Only ship supplies back to affiliated Monday through Thursday to ensure that we receive the shipment the next day. Review the highlights of this presentation before taking the quiz. Customer service is paramount. On-time arrival is a must. Set up and pre-draw no more than 10 doses of vaccine. Maintain a pleasant demeanor while moving through patients efficiently. Review consents as you administer shots, but if you start getting backed up, put off filling in your portion of the consent until time allows or at the end of the program. If you have any issues whatsoever, call us. Section 6, Flu Vaccination Training Quiz. To conclude your training for Affiliated Physicians Flu Vaccination Program, please take the following quiz. The quiz is designed to ensure that we provide our clients with the most knowledgeable nurses. It consists of 13 questions and will take about 10 minutes. When you finish the quiz, click Finish. Affiliated physicians will receive an automated confirmation that it has been completed. Thanks for completing our training. Please program this phone number into your cell phone, 646-535-2318, or you can contact Catch Meter with any questions you have.